Thank you for joining this important conversation about the state of HIV/AIDS today. Quest Diagnostics is honored to be a major partner in today's National World AIDS Day observance and the work of the National AIDS Memorial. Today, we bring together leaders who are on the front lines addressing the challenges of HIV and AIDS around the country. They are working to reach at-risk populations, deliver healthcare services and treatments, and helping our collective efforts to finally find a cure. Quest Diagnostics is honored to be a leader in the fight through advancement in diagnostic testing and by taking action through our Quest for Health Equity initiative to help people with HIV and AIDS have access to the care that they need. 40 years into this pandemic, and much progress has been made, but much work remains to be done to reach our goal. HIV continues to have a disproportionate impact on certain populations. At Quest, we understand how vital it is for companies to identify how we can all contribute to helping bridge the health equity gap in underserved communities to improve access to the critical resources we all need to be healthy. Today, this group of national leaders will provide an update of where we are as a nation on HIV/AIDS, the direction of national policy in the next decade, recent advancements in health and science, and the important work being done in communities most at risk and most impacted to ensure access to care and treatment. They will also examine the root causes, challenges, and opportunities for greater research, awareness, testing, prevention, and the outlook for an eventual cure. 40 years of fighting against HIV and AIDS has taught our nation so many lessons, and today we must recommit ourselves to learn from those lessons to help us reach the promise of a day when HIV and AIDS is behind us. On behalf of all my colleagues at Quest Diagnostics, thank you for being a part of today's conversation.
Hello, welcome to World AIDS Day and our conversation on the state of HIV/AIDS today in the United States. I'm Bob Wachter. I'm professor and chair of the Department of Medicine at the University of California, San Francisco, and I'm really thrilled to introduce our three guests for our conversation today. Harold Phillips, who's director of the White House Office of National AIDS Policy. Welcome, Harold. Paul Kawada, who's executive director of the National Minority AIDS Council. Welcome. And Monica Gandhi, who is my close colleague. She's a professor of medicine and the clinical lead in the Division of HIV, AIDS, and Infectious Disease at San Francisco General Hospital and at UCSF. So thrilled to have all of you here today for this important conversation. Obviously, the context is that we're in, I don't know whether to say, the middle, getting toward the end, but some portion of another pandemic, which is obviously consuming everyone's attention and has killed hundreds of thousands of people in the United States, millions of people in the world. And it's in some ways the elephant in the room as we think about what we've learned from HIV/AIDS, the impact of COVID on the AIDS pandemic. And so we'll get into that and then also talk about your reflections on where you think we are in the state of HIV/AIDS today. And I look forward to the conversation. So with that, let's start with Harold. You're in a position of leadership in the government. I know the Biden administration is focusing on HIV/AIDS, particularly on this day. And maybe you could share with us what you've learned about the White House and how it thinks about HIV/AIDS, and maybe with a particular focus on what the White House's response is to the HIV/AIDS pandemic on this World AIDS Day.
Sure. Thanks, Bob. And thanks for inviting me to be with you all as part of this World AIDS Day commemoration. President Biden on the campaign trail made several commitments when it comes to HIV/AIDS. One was a commitment to update the national HIV/AIDS strategy, which serves as our national framework for both programs, policies, and research that can help us end the HIV epidemic. The other commitment that he made was a commitment to the initiative to work toward ending the HIV epidemic. And also as part of President Biden's work, he has also requested $670 million, that's new money, to help us work toward an end of the HIV epidemic in geographic areas where we have disparities. So huge increasing numbers of new HIV infections. The other campaign commitment that he made was for us to look at ways to reduce or eliminate HIV criminalization. And so within the White House, my first task has been to develop a national HIV/AIDS strategy and to use the power of the White House to involve other federal departments and agencies and programs outside of HHS. Because when it comes to HIV, the issues like housing and food insecurity and employment are issues that impact those, put individuals at risk, and also become barriers to care and treatment. And so involving those other programs has been really important and an important part of the job of our office, the Office of National AIDS Policy, within the White House, as we formulate both the plan and think about how those other programs can work to help us end the HIV epidemic.
Monica, you have been front and center in the COVID discussions, and I know a lot of your thinking has been influenced by your decades of work in HIV/AIDS. So talk that through with us. Sort of how has your approach to COVID been influenced from all you've seen in HIV, not only in clinical care but in terms of the policy response?
Yeah, I think one thing that we learned in HIV early on is to try to stratify risks and figure out what's low risk activities, higher risk activities, and live within a framework of harm reduction. And that idea would be that you were going to be living with HIV for a while, for a long time, 40-year anniversary, and what activities are safe, what are not, and how to incorporate the human experience into living with a pandemic. And so I think my approach to COVID has been more along those lines, which is harm reduction. People do have to work. People do want to be together. How can we still stay safe from infection, but incorporate the real world aspects of life in this, unfortunately, long pandemic of COVID as well? So I think I learned a lot from HIV and human behavior and human stigma and loneliness. And every infectious disease for me, because I'm someone who's really interested in long-standing histories of infectious diseases, have always been about disenfranchised, the poor, housing insecurity, like you said, food insecurities, what are the disparities that happen with infections, and how to, if we can't write those, how to work within the fact that COVID was an infection that disparately infected minority populations in the US, and HIV is as well. And we'll talk about this later, but a lot of disparities deepened with HIV during COVID.
Before we get into the disparities, let me follow up with a question about the issue of harm reduction and how it is playing in terms of COVID and maybe the differences between COVID and HIV. I think my sense, because COVID struck so quickly, obviously HIV/AIDS did the same, but was a generalized risk for the entire population, and people had the sense that it would go away quickly. I don't remember from 40 years ago whether we had that sense with AIDS. It's too long ago to really recall. There has been a tension in terms of sort of a harm reduction. We have to live with this approach versus I'm going to hunker down and be as careful as possible because at some point the cavalry is coming. And so how have you navigated that tension? Because obviously a harm reduction approach makes tremendous sense if this is a problem that's going to be here to stay for the long haul, and you have to obviously live your life, and has some sort of inherent tensions in it. If you think that we're 6 months, 12 months away from, quote, this thing going away. So how have you navigated that?
Because it was such a transmissible respiratory virus, and especially the Delta variant of COVID, I didn't see this end in the same way in sight, because you can't actually keep people away from each other. It would severely detract from other aspects of not only one's personal mental health, but what was required to run a society and to think about other public health problems, including HIV and STDs and tuberculosis and malaria and everything else that we had to deal with. So from very early on, I don't think I saw it as anything but was something that was going to be with us, but that how do we control it? So the same way I think about HIV, it didn't have to be gone. It didn't have to be cured, though that would be great. It didn't have to be cured for us to figure out how to control it and adapt our ways that we live, both as providers, advising people and people who are living with HIV. It didn't have to be gone for us to live. And that was the amazing, I think maybe the optimism of just watching what happened in HIV, to have these medications keep on coming that were easier and easier to take, and watch people transition from life where everything was about the illness because you were taking handfuls of pills to life where you took one pill once a day and went about your day. And I think I thought of that we were going to get there and will get there in COVID, even if it's not gone. We will get there with antivirals. We've have an incredible preventative tool that we needed to have more people take in this country, which is the vaccines. And you just adapt your life to living with a pathogen, because if you halt life, there's actually some very dangerous things that can happen with thinking that you needed to wait until it was done.
Paul, you've devoted a lot of your professional career to helping address disparities, particularly in communities of color. And one of the things that's been striking to me is with COVID, it sort of is a feeling that the nation has discovered that there are disparities. It reminds me of the Casablanca scene. There's gambling going on here. So obviously, for those of us who've been working in health and healthcare for many years, we were aware of the disparities. How has this felt for you as sort of more people have recognized it? And have you felt like there have been opportunities in that recognition that came through COVID to help think about disparities and access more generally, including for HIV/AIDS?
When I agreed to be a part of this, it was because I know the important value of the Grove, particularly the Names Project, and all of the work that you are doing. Being able to remember and being able to honor those that we've lost is such an important part of healing. And for so many of us, we've become so damaged by our life experience of this epidemic. And I find the Grove and I find the panels to be a critical part of my ability to heal from all of the trauma of the early days of the epidemic. And so I'm so grateful to be here. COVID has shown America and the world the disparities of the world that we're living in. And I look at, we're at this unique moment where there are so many lessons. If you look at Black Lives Matter, if you look at climate change, if you look at the discussion around abortion, if you look at the discussion around immigration, our world is in chaos. And we are at the confluence of so many difficult and challenging issues. And what we have to figure out is, in the middle of all of those challenges, we got COVID. And how do we survive? And how do we thrive? And how do we continue on? And I will tell you, I don't necessarily have the answer, but I know it's been tough. And I am particularly worried for people living with HIV. The isolation and loneliness of HIV was well documented before COVID. And post-COVID, it's even made it worse. And so part of our challenge and part of the opportunity of forums like this is to talk directly to people living with HIV, to talk directly to people who have had COVID, and to let them know that they're not alone, that there is hope. And I'm particularly glad to have Harold here to talk about what the administration is going to be doing, because that's the important piece. having an administration that's willing to fight for us and that's willing to stand up and say we can end this epidemic is a critical goal. You know, it's that big audacious goal that gives you hope to move forward.
I guess I'm as you were speaking about that, and of course immediately I begin thinking about very close friends who've passed away of HIV over the years. One of the tensions that I think has become quite clear in COVID is how do you prevent yourself and the society from getting numbed by the numbers? Sort of to think about the individual and their stories, and that has a particular resonance with COVID, because in some ways now you have the HIV numbers, and people may say, look at the COVID numbers. That's where we should be putting all of our attention. The numbers are so large. So maybe start with Harold on that. As you think about crafting policy and crafting messages to make sure that HIV/AIDS is getting the attention it deserves, how are you sort of layering in the attention that COVID is appropriately getting from individuals and the media and social media? And how do you deal with sort of crafting messages that sort of appropriately balance numbers and data with the stories of individuals, which is what touches people's hearts?
Our response to COVID is built and crafted based on our response to the HIV epidemic. When we think about where we are today with the vaccine, a lot of that was based upon what we learned in searching for an HIV vaccine. When we sort of mobilized communities to be part of the COVID response, and the discussions about needing trusted community sources to develop and deliver the messages around how to protect yourself from COVID. And then when it was time to sort of line up and get the vaccine, doing those same things. Those were all lessons that we learned from our work in advocacy and service delivery when it comes to HIV. The other thing that I will say that has been really important throughout this is I think there's been a greater understanding of disparities. Sort of going through the COVID crisis while we were all sort of in our houses and sort of seeing this new move for social justice and Black Lives Matter and being able, and I think part of the isolation during COVID gave us some time to think and reflect and really try to work to understand. It wasn't like you could sort of run away and go back to your workplace or your water cooler or ignore it. It was right there in our homes. And I think it really made a difference and an impact. So I think, and now I think that we are learning so much about COVID and infectious disease that now it's going to help propel us forward as we continue the search for an HIV vaccine and also for an HIV cure. So as that research comes back online, they're going to come back online with much more understanding and knowledge that we can use coming out of the COVID-19 crisis. I think when it comes to sort of having and making discussions about policy and program and where does HIV fit into all of this, I think HIV is one of the number one disparities that impacts both communities of color, our rural communities, and puts women and transgender individuals and gender minorities at risk. And so being able to have those conversations about the intersection and ways to sort of address them, and having an administration that understands it and says at the federal level that this is important and that we have a commitment not to leave individuals and communities behind, allows us to be able to make the case for why HIV is still important.
I can imagine a world in Washington where it's all COVID all the time. That's where our priority has to be. That is what has disrupted the lives of, quote, average Americans. And HIV/AIDS gets less attention. This, in some ways, be natural, and in some ways, the resources that this year's budget had for HIV/AIDS, next year they go into a COVID budget. So, and some of that might actually be appropriate in the setting of the crisis that we're in now. But how do you ensure that at the end of the day, HIV/AIDS continues to get the attention and the budget that it requires?
We all know that we have got to address the COVID crisis. We've got to work to ensure that individuals get vaccinated so that we can get this behind us, or at least establish a new normal where, as Dr. Gandhi said, we're sort of living with it, but we know sort of the tools and techniques for harm reduction, and we're able to use them. And the number one tool is getting the vaccine. At the same time, we have been working on a lot of the other policy and program priorities for the administration. I think it was Susan Rice, who heads up the Domestic Policy Council, who said to us once in a meeting, we have got to walk and chew gum as a nation at the same time. So we've got to deal with the COVID crisis, but also recognize that as we turn the corner on COVID, there are a lot of other national priorities that must be addressed. And so the team has been working, I think, in tandem and trying to find that sweet spot between addressing the immediate crisis, but also recognizing that there are other priorities that we need to move forward. And we've been working on those. And I think some of those, we're starting to see as the infrastructure bill got signed. And there are a lot of other things that are on the plate as we kind of move forward, especially some of the health priorities and some of the priorities around equity.
Paul, anything you want to add in terms of sort of how do we maintain the appropriate focus on HIV/AIDS at a time where everyone is paying a huge amount of attention to COVID?
When you think back to those early days and you think back to the 80s when it was so scary and so frightening and there was so much overwhelming. I remember being in San Francisco during that time period and going to 5A and visiting friends and that moment when you had to say goodbye to somebody that you loved. Mm-hmm. And this has been a really tough time for a lot of people. The isolation has been exacerbated by COVID and by HIV, and a lot of people are hurting out there. Mm-hmm. And they're trying to figure out, what is this new world order going to look like? And I particularly want to speak to all the people living with HIV who are listening to this. I guess I want you to know that you're not alone. I want you to know that, and I'll say this for Harold, that the government really is trying. They really are trying to work to figure this one out. And we just need you to hold on. We just need you to hold on and to be there. My biggest fantasy in life is to be here when the HIV epidemic is over. Mm-hmm. For those of us who've been here from the beginning, it seems almost unreal, and yet it is that closure that we desperately need, because we've committed our lives to fighting this epidemic. We've lost so many friends, and we've wondered, what was it all for? And I think COVID asked the exact same types of questions. Mm-hmm. There has been so much death, and there has been so much pain, and there's been so much loss. And what is the lesson that we learn from all of this? And one of them, I think, is how we are to be as a society and how we are to be as a people. And the compassion and the willingness to stand up for each other during these difficult times is, I think, a mirror of who we want to be as Americans.
Thank you for sharing that. Monica, I'm going to turn to you and talk a little bit about the science. And, as we look at the extraordinary speed of finding remarkably effective vaccines for COVID in less than a year, and 40 years out for HIV, we still don't have them. Is that just because COVID was a much, much easier target? And do you think that coming out of it, the things that we learned about COVID vaccination will actually have utility as we turn our attention back to HIV/AIDS?
If we think about HIV's progress, it seems it's been fast, but it wasn't fast enough. And there are 37 million people who have died from HIV since the beginning of the epidemic. And it's sort of equal, actually, with the number of people living with HIV currently. And that still staggers me every AIDS Memorial Grove year, every World AIDS Day, what it took and it's still taking out of people. And virologic suppression rates have declined countrywide, and at least in major municipalities like San Francisco during COVID, especially among really disparate populations like the homeless, only a 20% virologic suppression rate here. We've dropped in our HIV testing 44% in San Francisco and haven't gotten back. So we're not on track. We have to get back on track with HIV. And then in terms of the vaccine, it is harder to, work with a virus that actually affects the very immune cells that you're trying to harness to use as the vaccine. But on the other hand, the mRNA vaccines are so cool and so sort of amazing. And I think they're going to be used for everything. We need a global flu vaccine and all sorts of things. We need a global SARS-CoV-2 vaccine ultimately that uses a different target. And mRNA vaccines are really amazing. And so the Moderna, there is a Moderna mRNA vaccine for HIV that has been tried in macaques was really positive, at least in what we've seen so far as a preventative agent, and it was small. And now the next step is it's being studied in humans, and we are hopeful, and that would be amazing because prevention is always better than treatment, and it would be great to have a preventative for HIV that wasn't dependent on access and taking a pill every day or putting a shot even every 8 weeks into someone's arm, but a vaccine. So I am really hopeful about the future with mRNA vaccines with HIV.
The fundamental obstacle to an HIV vaccine seemed to have been that the immune system doesn't work very well against HIV, whereas the immune system works seemingly perfectly well against COVID. Sometimes gets overstimulated, at least if you can harness it. How does the mRNA vaccine is obviously an extraordinary advance in terms of sort of telling your body to rev up its immune system, giving it sort of the operating instructions to do that. But then how does it potentially bypass that fundamental obstacle of how the immune system works in HIV? I
mean, you're right that HIV itself is, infecting the very cells, CD4 cells and other immune cells that we need to actually combat the HIV infection. And so this would be a preventative in this case, a vaccine to be even before people get HIV, that you would still use the intact immune system to be there and ready to combat HIV if the virus is seen. In terms of its use as a therapeutic vaccine, the mRNA vaccines, that would be next. And that would be exciting because fundamentally, when we say we're living with COVID right now, and we're living with COVID with preventatives in places that can get it, because the other lesson that I've learned from COVID is that we didn't learn from HIV in terms of global vaccine access and global access to PEPFAR. The government did address it, but it was many years in that we started addressing antiretroviral access worldwide. And we are nowhere near where we need to be right now in terms of providing global vaccines, rich countries providing vaccines for the world. But this would be a preventative before your immune system, is even altered by HIV in any way for the HIV vaccine. And then therapeutically, the dream would be that you could get off of antiretroviral therapy and just take a therapeutic vaccine. And the reason that is a dream, and the reason cure is a dream, and it's important to keep on talking and studying cure, is that even if you're living with something, you want it gone. You want it to be out of your body. And that's a very important and continued goal for us, is to have people feel like they can be cured. And so I am, I'm impressed with what we learned during COVID, and how fast things moved. And I think it can only help HIV. There's still, I think, there's upset in the community, as there should be, that things move so fast with COVID. And sometimes when things affect everyone, things move fast. And when an infection affects more stigmatized groups, it maybe didn't move as fast as we should have had it move. And now it's time to really get back to cure and see if we can get there.
We've talked about some of the positive impacts of COVID on HIV in terms of some of the scientific technology and people becoming more aware of disparities and addressing them. and the White House maintaining a focus on HIV while also walking and chewing gum. I want to talk about sort of one of the negative consequences and how you think it might impact our HIV battle. And that's misinformation, choose your own adventure in terms of which science you're going to believe or not believe. I've done a little fantasy in my own mind of what 1981 with HIV would have been like if there were all the alternative media sources and social media, none of which existed at the time. It's almost hard to fathom, but it's not a happy thought, really. So how does this media landscape and the skepticism about science and the misinformation and conspiracy theories and sort of the really remarkable number of people that seem to be believing those and choosing what they're doing about COVID, how do you think that plays out in terms of HIV/AIDS going forward? And because it seems like that's a genie that's going to be awfully hard to get back into the bottle. Maybe Harold, we'll start with you.
You may not be as old as I am, but I remember there was a lot of misinformation.
I am pretty old, but okay. Go ahead.
We had a lot of misinformation in the early days of HIV as well about how it was spread, and was it a toilet seat or was it inhalant poppers and all sorts of. I think the difference today is because we didn't have social media, it didn't spread as quickly and as far and wide and sort of get as deeply ingrained as what we've seen now with the misinformation around COVID-19. But I think to answer your question about how do we sort of combat this, I think, one of the ways that we're trying to approach it is by working through the National HIV/AIDS strategy to involve our private sector, social media, and communication partners to really work with us to help ensure that accurate, trusted information about HIV gets out there. And that's been one of the things that we have included in the national strategy for release as part of what the White House is doing on World AIDS Day. And as we get into 2022, looking forward to having a White House convening where we can talk about this and work with our private sector partners like those involved in social media to help us design and implement new approaches to making sure correct, accurate information gets out there. Like women who don't understand PrEP is for them and can't protect them. There may be communication venues that we can use and media that can help us that do things differently and faster than government. I think that's another one of those lessons that we've learned in COVID, because while we've had a lot of misinformation, there's also been some new steps to try and address the misinformation that's out there too.
I was in medical school when the first cases of HIV/AIDS were reported. And I remember that stage, but it really felt like it was a stage that was mostly born of scientific uncertainty. I mean, we just didn't know how this thing worked. I remember taking care of my first AIDS patient in 1982, and we just had no idea how it was transmitted. But it felt like once the science kind of locked in on, all right, now we understand it. It's a virus, is how it works. And this may be I've airbrushed 40 years of history, but it doesn't feel like there was alternative truth that at least to the degree that we see today, and becomes concerning because it may play out, and who knows whether it will impact the way people are approaching their own HIV/AIDS. Will people stop taking their medicines because they now believe some alternative story about what the medicines do and don't do for you?
Well, remember, there were the AIDS denialists. And in fact, San Francisco was the epicenter of those AIDS denialists. And ACT UP San Francisco was run by folks who believed that HIV was not the cause of AIDS. And so I think, there is always historically a group of people who always will never believe the science. And I remember thinking to myself, how can you do that? And I think the proof is that, unfortunately, most of those folks died. And so the reality that we're in right now has been mirrored by some of our experience, but probably not as much as kind of the COVID denialists that are out there right now. And I think the challenge is the same for both HIV and for COVID, which is how do we ensure that the vaccine or the services get to all the people that it needs to get to? And how do we overcome these barriers that are so much more profound than I think we assumed they were. There are many, many more people who I know who are rational, smart human beings who are not getting the vaccine. And it is shocking to me. And yet I worry, particularly because there's so many from communities of color. Mm-hmm. And that medical mistrust is historic, it's ongoing, and it is something that as a society, we are going to have to figure out how to address.
Monica, any reflections on this issue of misinformation and the social media swirl?
It does feel like a particularly dangerous time to me, actually, because it feels like you can be on TV and be a physician and say things that you usually weren't given that amplification before. Like, yes, there were definitely AIDS denialists and it was here, but not so much to being broadcast to millions of people or being up on a website where you look like you know what you're talking about and you say such dangerous things. So it is, I have like you, I have thought many times, what if this epidemic had started in the time of social media? It would have been a different epidemic. And we started in this country with, an administration that I think minimized what COVID was, and yet, and this administration is not minimizing it at all, but then now we're in the tension of that we have to live with COVID and going back to other things. And that's really amazing tension, because when I saw the measles vaccines, now we have about 2 million children who didn't get their second dose. And this was just announced by the CDC last week. I thought, like, this is the fundamental tension, is we can't, things are getting better. We have to focus, go back to HIV and measles and everything else. We have to, but what's the proper amount of tension, and yet not detracting from other things? And we were political both ways in this country. We also, because there was minimization, I think also on the left we also politicized things. We didn't give people sort of their own ability to evaluate their risk tolerance. And so I just think this became more political than I could have ever imagined on both sides. And I have never seen anything like this. And I hope that they stop people's accounts or don't put them on TV, but they can't do it. Like this is dangerous. It's really dangerous to have this misinformation.
We're coming to the end of our time. I maybe want to give you a last opportunity, a minute or so, to just reflect on what this day means, and being 40 years into the HIV/AIDS epidemic, how you're thinking about it on this particular day. Maybe you start with Harold.
The quote and the memorial are so important because it does give us that time and that opportunity to reflect. And I'll try to make this brief. The last time that the quote was shown in its entirety here in Washington, D.C., back in 1996, I was working for the National Minority AIDS Council. And you all had given us the opportunity as staff, even though we were doing the conference, which is now the United States Conference on HIV/AIDS. It was all that same weekend. So it was an extremely activist, exciting, exhausting, and emotional weekend all at the same time. The quote was here. The United States Conference on AIDS is here. And I think that might have been the first time that the conference reached 2,000 individuals at its peak. So staff was working, but you all reached out to us and said, if you wanted to read names or participate in sort of the unfolding at dawn, you could have that opportunity. And some staff did the unfolding at dawn. I am not a morning person. So I read names. And you also gave us the opportunity to, after we read our list of assigned names, to add the names of friends that we had lost. And I added the names of 3 friends. And I just remember my almost losing my breath as I looked out at the mall. We were sort of reading from the Capitol steps, and you saw all of those panels and recognizing that those are individuals and those are lives and those are people's friends. And then adding the names of 3 friends of mine that I had lost. It was an opportunity that I'll never forget. And it's one where when I'm doing this work on some of the difficult days, I remember why I'm doing it and why it's so important and why World AIDS Day is still so important. And I thank you all for giving us those opportunities to hold a space for those memories and those people, those friends and family that we have lost, and why we continue to do this work. So thank you.
Thank you so much for sharing that. Paul, any reflections?
You're going to make me cry. Damn, you're going to make me cry. You know, I think that's what brings us together as a community, are those moments. You know, when the quilt came to DC in '96 and we were part of the unfolding, it reminded me of the humanity of our movement. And I really want to thank the AIDS Memorial Grove and the Names Project for keeping that candle lit, for continuing to remind us every day of the humanity and of the loss, and just the extraordinary gift that you bring to all of us. So thank you for inviting me, and thank you for having this important discussion.
Thank you. Monica, I'll give you the last word. What are your reflections on this day?
I am constantly moved by HIV and by being privileged enough to be working in HIV for this long. It is the Grove has been a place for me of beauty and poignancy, and I don't know how many times I give a talk on HIV, and I choke up when I think about just literally the name Ryan White. It's just a privilege to be here with you all and to be lucky enough to be in a movement that's about social justice and science and combating everything that's unjust. And it's been incredible. It's just been an incredible honor to be an HIV doctor for this long. And I really thank everyone for inviting me here to this celebration.
Well, I want to thank the 3 of you for a powerful session. And one of the things I really loved about it was you can talk policy and it can very quickly devolve into numbers and budgets and plans and things like that. And that's all real and really important, and ultimately will impact whether people live or die and how they do. But ultimately, this is about humanity and people and lives and families and friends and loved ones. And so I think you've made that immensely clear. And so I think that's really made this a very special session. So thank you very much.